I'm asked about the insertion of the S1 screws and the tips that I can give regarding that. Let's start a little with the anatomy. Here we are able to see, first of all, the spinal process of the L5, and here the pedicle of the L5. You see the surrounding of the pedicle right here. Pedicle of the S1 is sometimes harder to see because the angle is not right. The direction of the X-ray is in this direction, so sometimes the angle is not right, and pedicle is big. Sometimes that makes it harder to see. But the pedicle of the S1 is practically that structure, and here you see it's surrounding of that. Additionally, here's the pedicle of the L5, which is easier to see. This is the spinal process of the S1, and here you see sacroiliac joint. So these are the basic anatomy of the sacral region. And here in the lateral view you see the pedicle of the L5 and then pedicle of the S1. Now we need to look at a little at the anatomy. This is the ala, and now I'm going to show you actually on a model how these structures look like. So practically the ala is this part of the, or wing is this part of the joint. As you see, if you look at it from the bottom, that it actually comes out, and this is the sacrum, and the ala is here, and this part of the ala is what you see in the lateral view that we just showed. And if you look carefully in the front view, there is a notch here, right here. Is maybe somewhat harder to see here, right there. This is a notch. In open surgery, I always try to find that notch, and then here, below, almost below the pedicle, as outside as possible, as lateral as possible, is their starting point of the sacroiliac or S1 screw. And on the picture we are going to look at it again where that would be. So again, this is the ala, the wing that's coming out, and now let's look at the ala on the other side, and here is where the ala comes to the the rest of the sacrum, and here is the body of the sacrum. On the model, this is actually practically the difference between this structure and this structure. Now let's get back to our picture here, and here we see the rest of the sacrum, and here my entry point again. I was always surprised how much lower and more lateral I needed to be for the sacroiliac joint. I'm sorry, for the S1 screw placement, both open and minimal invasive. And so practically that is the area it needs to be, just below the notch, and as far down and lateral as possible. This is the ala. Again, let me just go back here. Actually, I mean, this is the angle for the sacroiliac, I apologize, for this S1 screw, pedicle screw. You see it's parallel to the disc and end plate of the L5S1. And this is the angle for the alar screw. On the model, if you look at that again, practically to put a sacral pedicle screw, we need to go inside of this structure here at this angle from outside to inside. For the alar screw we need to go just the other way, but as well more angle down to be inside of the alar part. Especially when the iliac crest is overreaching and it doesn't give you a good outside to inside angle, the alar screw become much more useful. Or sometimes as well you can use the S2 screw. Find in the open surgery, find the foramen and then go shorter obviously screw, but as well in the MIS it's possible to utilize it. Now here we see the difference of the red alar screw versus pedicle screw in the lateral, and now we are going to see the alar screw in the AP and lateral pedicle screw in the AP. And practically that is the tips that makes insertion of the S1 screws easier. Thank you.